Have you heard of Royal Care Counselling Outreach? If you are yet to hear of Royal Care Counselling Outreach, this is a platform that gives you counseling on whatever might be bothering you. So if you are yet to make a bookings and you have any personal, social problems, vocational problems, or educational problems, or even marital or relationship problems, mental health issues, please don't forget to contact Royal Care Counselling Outreach. Make a booking with us right now. So this is Royal Care Counselling Outreach, and I still remain your online counselor. If you are new here, please don't forget to subscribe, and if you find this video very educative to you, don't forget to give us a thumbs up, and don't forget to put your questions or your contributions below. So today I am going to be talking of fibroid. However, I've talked about fibroid in one of my previous videos. If you are new here, don't forget to watch my previous videos. They are very educative, and I promise to bring to the table effect of pregnancy on fibroid, or effect of fibroid on pregnancy. So on today's episode, we are going to be talking of effect of both pregnancy on fibroid, or effect of fibroid on pregnancy. However, do you know, or are you aware that fibroid can cause infertility? However, fibroid doesn't stop pregnancy from occurring, because I'm sure some of us have heard of a woman who is pregnant and has fibroid, or somebody that is about to give birth and they said fibroid is not allowing her to give birth the normal way, or however, fibroid is battling or struggling with space in the uterus with a baby. Let's talk about the effect of fibroid on pregnancy. Number one is pregnancy wastage. Fibroid might usually occupy space in the uterine wall where implantation is supposed to occur. However, if implantation occurs around the uterine wall, it can lead to ectopic pregnancy. That's why we hear cases of ectopic pregnancy, because the fibroid is in the space where implantation is supposed to occur, so it leads to pregnancy wastage. Number two, we have malpresentation and abnormal lie. When a child is developing in the mother's womb, the child has the opportunity to change or turn to whichever position he or she likes. When it is time for delivery, the child positions itself for delivery, making the head to be at the pelvic axis of the mother. However, with the existence of fibroid, the child in the womb finds it difficult to position itself for birth, because the fibroid might be blocking the pelvic area where the child is supposed to position itself for birth. So that leads to malpresentation and abnormal lie. Number three, we have large foldate uterus. However, this is a situation whereby both the fibroid and the pregnancy are competing for space. That is why the stomach is usually large than normal, usually bigger than normal. You hear of situation whereby people around start to call the woman Iambu, mommy twins, expecting that she delivers twins or triplets because of the way or the large size of her tummy. Sometimes it is as a situation or as a result of large foldate uterus. Number four, we have difficulties hearing or feeling the fetus heartbeat. However, it might be difficult for a pregnant woman to be able to feel a fetus heartbeat. Sometimes they might even tell her, we can't feel the heartbeat of your baby. It is the work of the sonographer to be able to identify, okay, the fetus is here and the fibroid is here. So a woman who has fibroid, it might be difficult to feel the baby's heartbeat normally. So the work of the sonographer is to be able to space out where the fibroid is going and where the child is going, to be able to feel that your baby's heartbeat is still normal and is going as he or she ought to go. Number five, we have placenta previa. However, during delivery, during normal child delivery, we have the delivery of the child first, and after the child's delivery, then of course the placenta. But because of the existence of fibroid, the placenta blocks or presents itself before the baby, meaning the placenta comes out first or shows face first before the delivery of the child. That is because of the existence of fibroid. It is called placenta previa. Number six, we have abortion placentae. However, this is the separation of the placenta from the uterine walls, meaning the placenta detach or separates itself from the uterine walls from the baby, causing the baby to be at risk. That is what we call abortion placentae. Number seven, we have prolonged delivery. The areas of the uterus affected by fibroid cannot contract like the normal uterine wall, leading to prolonged delivery. Without contraction, you cannot give birth. And when some areas in your uterus is not contracting, it leads to prolonged delivery. Number 8, we have obstructed labor. This is a case of cervical fibroid. However, in this case, the baby has grown fine, the baby has developed okay. It is just time for the baby to be delivered. So when it is time for the baby to be delivered, the growing fibroid blocks the cervix of the woman, making it difficult for the baby to pass through to be delivered. So the cervix area is automatically blocked by the growing fibroid. Number 9, we have postpartum hemorrhage. This is a situation or a case whereby the woman bleeds after childbirth due to the result of poor contraction. It's just close to prolonged labor. Prolonged labor is because some uterine walls cannot contract. However, after some uterine walls cannot contract, which leads to prolonged labor, when she finally gives birth to the child, she might develop postpartum hemorrhage, meaning some of those contractions that did not occur makes it difficult for some of the blood vessels to be blocked automatically, because after childbirth some blood vessels automatically blocked, but because of the existence of poor contraction during delivery, it makes it difficult for those blood vessels to automatically block itself. Number 10, the last but not the least, which is slow evolution. However, after childbirth, the uterus goes back to its former state and shape, but because of the existence of fibroid, it makes it difficult for the uterus or the body to go back to its pre-pregnant state, meaning after childbirth the uterus goes back to its pre-pregnant state. That is, your stomach begins to go down, but because of the existence of fibroid, instead of the stomach to go down, like okay, this woman has given birth, she's no longer pregnant, the stomach still remains the same. The stomach still remains bloated, it still remains big, so it still looks like she's pregnant, meaning the uterine walls or the uterus has not gone back to its pre-pregnant state and shape. It still looks like she is pregnant. I don't know if I'm making any point. So these are the effects of fibroid on pregnancy. If you are new here, you're yet to watch our video on fibroid, please go and watch it so that you are going to be conversant or more knowledgeable about this episode, because if you are yet to watch it, you might not understand this particular episode, but if you have watched it, you will understand this particular episode. Please don't forget to subscribe to our YouTube channel, and if you find this video very educative to you, don't forget to give us a thumbs up. And if you have any questions or contributions, please don't forget to put your comments below. Ask to remain your online counselor. And don't forget, if you need us for any counseling booking of your choice, we are available. We are available for marital counseling or marital therapy. We are available for mental health therapy. We are available for personal, social, relationship therapy. Please don't forget to make a booking with us. We are also available for career and vocational counseling. Ask to remain your online counselor. Bye-bye.